Okay, so Amy, right now what we're going to do is just go over each of your body systems. It's called a review of systems. We're just going to kind of go down and just we'll talk about each of the body systems.
Okay.
So just generally overall, how do you feel? Are you feel good? You losing weight or gaining weight?
No, I feel good overall. I have lost maybe about like 12 pounds over the course of like 4 months. And it was intentional weight
okay.
loss.
I was going to ask, did you mean to?
Yeah, it was intentional weight loss.
Good. That's great though. What about, do you ever get like at night any chills, fevers, any night sweats, any?
No, none of those.
Okay, good. What about as far as your skin and your hair and your nails go? Do you have any skin issues? Like any?
No skin issues, no like excessive dryness or anything.
No rashes?
Yeah, no rashes.
Okay.
No suspicious spots that I can think of.
Okay.
Like that.
What about so your hair? Your hair looks like it's good and thick.
Yeah, I have trouble with it in the shower. It seems that I just can pull out kind of globs of it when I'm trying to get all the water out. I've got a bunch of hair in my hand.
Right.
Great.
Okay.
So, but I mean,
might just be.
Yeah, I don't know what it is, but it's always done that, and I still have a full head of hair, so I guess I'm okay.
Right? It must be okay. Yeah. So what about any like fingernails or toenails? Do you have any? Any like?
No.
Any ridging or any?
No really fingernail problems. My toenails, my great toes, they after summer is over, I wear polish in my nails pretty much all summer long.
Mm-hmm.
And after summer is over, on the big great toes, there's kind of like a white film over them. I think it might be like a fungus or something, just not letting my toenails breathe. From all the polish. But that's it.
But other than that, nothing else you can think of. What about as far as your ears go? Do you have any trouble with hearing? Do you have any drainage? Any ear pain?
No ear pain, no excessive drainage.
Any ringing or anything in your ears?
No hearing issues, no ringing. No really like no dizziness or vertigo or anything like that either.
Great. Okay. What about eyes? And you told me earlier that you wear contacts and you take them out at night, which is really, really good. Do you have any other eye issues? Do you have, like lots of tearing or itchy eyes or red eyes or?
No, not really. Occasionally they do get dry, and so I'll use occasional eye drops, just a lubricating eye drop to moisten them, but really no other issues.
All right. And then of course we have like our sinuses, nose, sinuses, all that. Any issues, any drainage or bleeding or lesions or?
No, nothing like that. I've got the just occasional seasonal allergies. I feel that is worse in the summertime. And I'll just take like over-counter Zyrtec or something like that for it, and it clears right up. So they're not too bad.
Okay. So what about mouth, throat? Do you have any dry mouth or any sores in your mouth, any lesions, anything that is concerning?
Nothing like that. I mean, every now and then I'll burn my tongue or bite the inside of my cheek, but nothing.
Okay.
Yeah, nothing like long-term issues.
Any hoarseness or voice changes? Any?
Not that I've noticed.
Okay. No issues with swallowing or anything? No choking problems or anything like that?
No.
Good. What about, you told me you go to the dentist regularly, which is wonderful. Any other teeth issues, any pain or sensitivity to any of your teeth?
No sensitivity really, no issues. Like I said, I've had my wisdom teeth taken out.
Right.
But other than that, like I said, brush teeth twice a day, floss, try to. That's it.
Very good. All right. What about your neck? Do you notice any stiffness or any pain or lumps or any growths, anything that would cause you concern in regard to your neck?
No swelling. No, it seems like I can move my neck around pretty well. I don't have any issues with that.
Okay, so you're good range of motion then in your neck. That's wonderful. Cardiovascular. So heart-wise, you mentioned you wore a Holter monitor when you were younger, and they didn't find anything. But you still experience some palpitations, you said?
Yeah.
Just here and there?
Here and there.
Okay.
it goes away on its own.
Any pain with it? Any shortness of breath with it?
No,
No.
it's just the palpitations. I could just feel it kind of speeding up and kind of like skipping beats. And I just kind of have to sit down for a minute and just kind of relax, and then it goes away.
Okay. So, what about?
I do. I have a Fitbit that monitors my heart rate,
Oh,
and so usually my resting heart rate's like 70s, 80s.
good.
But it can jump up whenever I do have those palpitations. It jumps up to over 100.
Wow. All right. So that's interesting, especially with your familial history of AFib.
Right.
So makes you kind of wonder what's
exactly.
going on there. What about? Do you ever have any like peripheral edema? Any murmurs that you've ever been told about? Or
no murmurs, no peripheral edema or
dyspnea?
no shortness of breath.
Okay.
Nothing like that.
Good deal. What about respiratory wise? Have you ever had ever been diagnosed with asthma or COPD? Any breathing issues at all?
No breathing issues. Sometimes I do experience that pleurisy from time to time,
Okay.
but it kind of just resolves on its own.
Okay, so you don't have to go to the doctor or
No.
hospital or nothing like that. Okay. Any coughing or wheezing or
No.
hemoptysis?
No.
That's a tongue twister. What about gastrointestinal wise? So you have a good appetite. You eat really well. That's good. Any heartburn ever?
No, never. I love spicy foods, and I never had
Good.
an issue with it.
Lucky. What about constipation, diarrhea, vomiting, nausea? Any of those?
No, none of the above.
Okay. Have you ever noticed having any black or tarry stools? Anything that would indicate you might have some blood in the stool? None of that. Okay. Any gallbladder or liver problems that you're aware
of? Not that I know of.
Okay. What about food allergies? Do you have any food?
No food allergies.
You just don't like vegetables?
I just don't like vegetables.
Gotcha. All right. So have you noticed any pain or bulges or redness in your abdomen at all?
No.
Okay.
Abdomen's fine.
So genitourinary, which would be, are you having any issues with voiding? Are you able to void, and do you feel like you are retaining any?
No issues with voiding. As you know, as a nurse working 12-hour shifts, sometimes you hold it for a lot longer than you should, and so that's my one thing is I maybe only go once to twice a day.
Yeah.
I hold it for so long, but I don't really have any issues related to that.
Okay. What about at night? Do you ever have any like frequency or nocturia where you have to get up and?
No, I sleep through the night. I don't get up to go to the bathroom. If I do, I just go right back to sleep and I'll worry about it in the morning.
There you go. Urine's good, clear, yellow.
Yeah.
No foul odor to it. Okay. You ever have any history of any UTIs?
I've had UTIs before, but they're not recurring or anything.
Okay.
Maybe just one or two in my life.
All right. What about as far as rectum stuff? Any rectal pain? Any bleeding? Hemorrhoids?
No hemorrhoids. No bleeding.
And any incontinence?
No, not at all.
You're so young, right? I highly doubt it. What about your reproductive system? So you told me that you're due to go back soon for your 5-year pelvic exam. So have you noticed any lesions, any discharge, any odor at all?
No abnormal discharge or any issues there.
Okay, and you said you've been with your fiance for 9 years, so same sexual partner.
Yeah.
Any history of any STDs at all?
No.
Okay, very good. What about musculoskeletal? Do you have any back pain? Any pains in your bones or joints?
I have an occasional lower back pain, but usually if I just lie down, it kind of resolves itself.
What do you think brings it on?
Working. Being on my feet.
Okay. What about any limitations to exercise? I know you like to go walk when you get off work. Do you?
No limitations.
Great. What about any gout or anything?
I've never been. I have all the symptoms of gout, but I don't have really like any of the risk factors, and so I don't know. I've never been diagnosed with gout, but my left noticed my left great toe will be very painful after working for 12, 13 hours. And it's just like the toe itself, it hurts.
What can you describe the pain? Is it like sharp or throbbing?
It's like a throbbing pain, and I would probably rate it like an 8 out of 10. It hurts really
what
bad.
do you do
I don't know
about it?
I just lay in bed
Okay.
and just kind of get off my feet, and then it eventually goes away. It's a little tender to touch.
Does it affect how you walk or anything? Does it affect your gait?
No, not really.
Okay.
No, it just hurts.
How strange.
Yeah, it's a constant throb, constant pain.
But just getting off your feet makes it resolve?
Yeah.
Okay.
Mm-hmm.
Wow, that's interesting. Because you don't have really any of the risk factors for
gout.
Yeah, you don't drink lots of beer and
no.
eat a bunch of steak or liver or whatever they say, red meat or.
Sure.
What about your vascular system? So you said your hands get cold.
Yeah.
And you said your feet get cold.
Yeah.
So, but do you have any leg cramps? Any?
No leg cramps.
Any varicose veins?
I do. I've got some varicose veins on the inside of both of my knees.
Okay.
That's it.
Let's see. Feet and fingers. So yeah, basically, neurological. Okay, so we need to know about neurologically. Do you ever have any fainting spells or blackouts, seizures?
No, none of those.
Weakness, tremors. Okay. What about let's see. So never have any disorientation or anything.
I guess sometimes in the morning my hands will get tingly, and I don't know what that is, or I don't know. So my hands just get tingly sometimes when I'm driving to work in the morning, and then by the time I get to work, they've resolved and it's gone away.
How strange.
Yeah.
Does it feel like they're just asleep from sleeping on them weird, or?
Well, it's not quite that feeling, but it is like a tingly feeling. And I think, I don't know, it may be because sometimes I feel that way whenever I've had like anxiety, like breathing, too much, and then I get kind of tingly hands, tingly face. But so it feels like that, but it's just in my hands. And so I don't know.
All right.
I always think, well, crap, am I having a stroke? But
right.
It goes away. So
right. I think I would think that too.
Yeah.
You start doing the
stroke. I look at my mirror and face my
smile straight. And, right. So mental status? Do you ever have any confusion, depression, any psychosis?
No confusion. Not really any depression.
Sounds like you have a little bit of anxiety sometimes.
Yeah, a little bit of anxiety, but not depression.
Okay. So emotionally, would you say?
Emotionally, right now, I would say I'm stressed with planning a wedding, working, going to school. So
yeah, you've got a lot going on.
Yeah.
So
stress.
What do you do when you have?
I like to do yoga, and yoga kind of keeps my mind off of everything and just kind of helps me to reset.
That's good. So that, along with your meditation, too, because you said that that's really good. Yeah. I like that. So what about hematologically? Have you ever had any blood clots? Any bleeding disorders? Any anemia?
No. I don't have any really bruises or any bleeding disorders.
Okay, good. Any DVT history?
No.
That's good news. What about endocrine system? So, have you ever been diagnosed with diabetes?
Oh no, I think my A1C is like 5.2, and that was from like a screening last year.
Great, so you're good there. So no excessive thirst, excessive urination.
Yeah, no.
Okay. Any thyroid issues that you know of?
No, not that I know of.
You haven't noticed any just enlarged thyroid, any
No.
goiter or any of that? Okay. All right. Well, I think that's it. Thank you very much, Amy.
Thank you.